Every speech language pathologist should know who you are. You are a guru in the field of speech language pathology.
We're going to talk about the importance of chewing to building the maxilla and the mandible, and why people, no matter what age they are, should be chewing and swallowing and resting their mouth properly.
What I really want to get across is a lot of that early intervention, feeding, oral sensory motor, it's very specialized.
Dr. 𝐃𝐈𝐒𝐂𝐋𝐀𝐈𝐌𝐄𝐑 became a good friend. He found my 2010 book, he started to cite it, and he started referring patients. And then I edited 2 of his last articles. Proofreading for Dr. 𝐃𝐈𝐒𝐂𝐋𝐀𝐈𝐌𝐄𝐑, I learned that a lot of things developed in utero.
Good mouth development is extremely important for the health and well-being of a baby. Birth to 2 years of age is a critical learning period for the development of mouth skills.
I'm focusing on motor speech beginning at birth. We had a booklet that thick from ASHA in 1991 all about orofacial myofunctional therapy. We now have a much broader scope, and you can get board certified in swallowing now.
When you see a young child, a baby, a 1-year-old, and you see muscle dysfunction, you see orofacial myofunctional disorders, you have to refer them to the correct person. Where would providers find, or who would they look for if they notice there's problems in a child that's young?
All COMs are not trained to work with babies. We really need to find our colleagues and make our teams. I've always had somebody beside me where I can co-treat or I can refer, and I know what they do. People have different skills. You just can't assume somebody who has a particular credential is going to be able to solve the problem.
Children under 4, it's not the same type of treatment program that a traditional myofunctional therapy program would be.
Sensory motor learning requires attention, focus, and concentration. When it comes to learning, eating and drinking, and even speech, if you don't have daily practice, you're not going to get those skills accomplished. It's not enough to have a parent and child come once or twice a week and think we're going to fix a problem. The anterior tongue response, people have been confused about that for years. It's not the tongue thrust response. Tongue thrust is never normal. It's the difference between breast and bottle feed. It's a different mechanical process, a whole different set of motor plans. It's qualitatively different. The pressures are different. Profuse drooling, never normal.
This just brings home that piece that those early feeding skills, oral sensory motor skills, set up that foundation for later developing skills or simultaneously developing skills like babbling, speech, breathing, airway. There are so many details to the work that the speech pathologists and the OT who are early intervention feeding oral sensory motor specialists are doing. This is a whole area of study and expertise.
Yeah. You don't need a lot of tools, actually. You just need the right tools.
And the right education and training to be able to help these babies and these young children, because it is so important that when we see dysfunction, we get it supported, treated as early as possible to prevent future problems. If somebody like a dentist, a dental hygienist, is working with a child, maybe they see a baby at their first visit, or a 1-year-old at their first visit, and they see profuse drooling or open mouth breathing, they shouldn't think, oh no, we can't do myofunctional therapy until they're 4, we can't do orthodontics until they're older, so we just can't really do anything. That's absolutely incorrect. You can refer to a qualified speech language pathologist or occupational therapist who has skills in oral sensory motor and feeding therapy for that early intervention age group, so they can start getting that child on the right track.
You have to have people who are specifically trained. I found the people I needed. I found the ENT, the dental people, the OT, the PT. You need the different professions.